Good afternoon, everyone, and want to welcome you to joining us today for the launch of the Stepping Up Kansas Technical Assistance Center. Next slide. So before we get started today, I would like to first introduce the team from the Council State Government's Justice Center. Hi, everyone. I'm Risa Hanneberg. I serve as the Deputy Division Director of our Behavioral Health team. And in my work, I am involved with the Stepping Up initiative at the national level, as well as other projects and work that I do across the Justice Center that involves work at the county level. Also today with us is Katie Haber, a program director. She is also a part of the Stepping Up team, as well as managing other projects and also a lot of work at state level. And Mark Stovall, our senior policy analyst, a big thank you to him today for managing the Zoom technology for us. And Mark is also involved with Stepping Up initiative at the Justice Center. Personally, I just have to take a second to say that I'm really excited to reconnect with many of you that I worked with during my days in Johnson County. So it's really great to bring this project to Johnson County and to Kansas for me. Just a quick review of our agenda. This afternoon, we want to acquaint you with the plans for the Kansas Stepping Up Technical Assistance Center. Some of you have already expressed that you want to participate in this project. Some of you have attended other earlier presentations we've had on the project. And for some of you, this is your first time learning about the Kansas Stepping Up Technical Assistance Center. We plan to cover all the bases today and officially launch this center. From you, we ask the following. We would be happy to have one-on-one conversations after this meeting to talk with you. If you have any questions, if you want to just get some initial thoughts about where you might be starting from and just generally kicking off the work for you at your county level. We would ask and hope that you want to learn about what the TA Center can provide for you. And we hope that we entice you into participating today. We will have time for questions at the conclusion of the presentation today. And we look forward to working with all the sites across Kansas. I think Mark might have just put this in the chat box, but if you would, we find that it's just nice to go in there and enter your name and your position and where you're from, just as a way to greet each other while the presentation is going on. Also, please feel free to enter any kinds of questions that you have during the presentation in the chat box, and we'll try to get to those at the presentation, or we will follow up with you. Next slide. We're excited to have several speakers joining us today, and we hope from the conversation you'll see that the TA Center will be designed to support you in your prevalence reduction goals to reduce the number of people with serious mental illnesses and substance use disorders in your jail and across your justice system. We're especially excited to share with you today this state-local partnership that is being established to work together in achieving these goals. So to introduce that work in this project, I'm going to turn it over to Commissioner Andy Brown from the Kansas Department on Aging and Disability Services. Commissioner.
Hi, everyone. My name is Andy Brown, the Commissioner for Behavioral Health Services at KDADS. And I was telling everybody earlier today, I'm very excited about this. I almost have butterflies in my stomach about getting this project launched. So thank you for joining us today. All across Kansas, local communities recognize the growing need to find better solutions for linking people with mental illness to treatment and services while improving public safety. We have been working in coordination with the Governor's Behavioral Health Services Planning Council and the Mental Health in Jails Work Group over the last couple of years. KDADS is working with our local behavioral health and law enforcement leaders to try to address the need that we see for people getting these services in a way that helps divert them from jail and incarceration. So the Kansas Stepping Up Technical Assistance Center has been developed as a result of local leader recommendations, and we hope that you will see a lot of the work that you put in over the last couple of years in today's presentation. So this TA Center is funded through KDADS for the next 3 years with federal mental health block grant and substance abuse block grant funding from SAMHSA. And the intersection of mental health, substance use, and criminal justice is a priority here at KDADS. It's a priority for me. It's a priority for our secretary. And we hope that the counties that are participating in this opportunity are able to take advantage of them and really have Kansas shine as a leader in the Stepping Up initiative here in Kansas. So thank you very much for being here today.
Thank you so much, Commissioner. I'm now going to turn it over to Dr. Aisha Delaney-Brumsley. She's the director of the Behavioral Health Team at the Justice Center. Aisha.
Thank you so much. And Commissioner Brown, as excited as you are to have this project start, we are also excited to be working with you on this. So first of all, I just want to say good afternoon. It's really wonderful to be with all of you here in this virtual room. And I want to start by saying a huge thank you to the Kansas Department of Aging and Disability Services, especially Secretary Howard, Commissioner Brown, and Andrea Clark for recognizing the importance of this work and for funding the TA Center to help respond to local needs. You all, some of you know this, but some may not, but Kansas is the second state in the nation to set up a statewide Stepping Up Technical Assistance Center. And you all are truly at the forefront of committing state support to help your local communities keep people with behavioral health conditions out of jail whenever possible. And the Justice Center is just really honored to be working with KDADS and with communities across Kansas to support those efforts. We've actually been fortunate to have a really long history of working with you and your partners across the state, both through your justice reinvestment work and through our support of numerous communities that received grants through the Justice and Mental Health Collaboration Program and through the Second Chance Act. And we're also extremely fortunate to have Chief Gordon Ramsey of the Wichita Police Department on our Justice Center board. So we're going to bring all of that experience and that history in Kansas to our work within the TA Center, and we're excited to get started and to support all the important work that you have already put in motion. So thank you very much.
Thank you, Aisha. I'm now going to call on Andrea Clark from KDADS. She's going to provide some additional background on how this project got started and the role of KDADS going forward.
Oh, good afternoon. First, I want to thank everyone who's joined us today. Some of you have had the chance to speak with about Stepping Up already, and I'm looking forward to continuing this work as we move forward with your community. And many of you, I'm also excited to get to know you that are new to this work, and hopefully we'll be working together soon. So Stepping Up Kansas Technical Assistance Center. Really, this is a project designed to offer technical assistance tailored specifically to participating Kansas counties and to support local programs and policies to really improve outcomes for people with mental illnesses in local jails. We have established a leadership team of state and local representatives that have been working as Commissioner Brown mentioned, to really develop this proposal and really listen and be directly informed by the local needs in this work. KDADS sees the TEA Center as really an opportunity to continuously hear feedback regarding challenges and opportunities at the local level. So while this Technical Assistance Center is supporting local efforts, you're also helping KDADS in thinking about options for additional support and policy change and coordination moving forward. The TA Center is a way to really help position counties to be ready to take advantage of additional opportunities that KDADS or other state agencies may have that support this and other related work. We believe that reductions in the prevalence of mental illness in our justice system is an achievable goal, and that the Stepping Up process will help guide counties to work what's really for them, what really works for them given local data and circumstances. Many of the counties who have done work already through the Stepping Up process have started off with either no funding or small grants and really capitalized on those efforts to make small improvements to be successful and have led to real outcomes for their community. Counties can capitalize on these small wins and build on those successes to demonstrate success. Most counties on the call today or that will begin this work won't have all of the necessary leadership commitment across all systems or have all the necessary funding, but the TA Center is really here to help build slowly on what is available and slowly on wins for years moving forward, to help target work in the future. The Behavioral Health Commission and KDADS were really proud to support the Stepping Up TA Center, and proud to be able to work with counties to find a path to do this work in their own community. So, thank you.
Thanks, Andrea. Mark, can you go to the next slide? That would have been Andrea. So let's go to the next one. There we go. Thank you. So I'm going to give just a little bit of background about the Council of State Governments Justice Center. As Aisha already said, we actually have quite a bit of history working here in Kansas, but just for to make sure everybody has an understanding of who we are, the work we do. The Justice Center develops research-driven strategies to increase public safety and strengthen communities. And we are nonpartisan, non-for-profit organization that works with all branches of government and all levels of government. We work to bring people together to really try to push forward criminal justice, particularly around research and data. We like to assist and work with people to build momentum for policy changes and provide some expert, we'd like to think we're providing for you a lot of expert technical assistance to help push this work forward. Particularly the behavioral health team, which is the team that's working with you on the Stepping Up initiative. Our work is in that cross section of criminal justice and behavioral health. Next slide. So just a little bit of Stepping Up background for you. As I know, some of you have been at this for a while and you're familiar, and others, this is new for you today. But Stepping Up is the national initiative to reduce the number of people with mental illnesses and co-occurring substance use disorders in jails. And this project was initiated in May of 2015. So this past year, we actually celebrated our 5th year, and our partner organizations for this work is the National Association of Counties, or NACO. I know many of you are members of NACO, and the American Psychiatric Association Foundation. We began this initiative in recognition that there is a lot of broad support across both criminal justice and behavioral health sectors, that the issue of too many people in jail and getting stuck in jail, particularly because of mental illnesses and substance use disorders, was really a problem we could all agree on, was one that wanted to be solved, but yet how to go about this, there was not a lot of direction or how to really make these changes on a broader scale. Stepping Up is a data-driven cross-systems process approach designed to meet counties where you are and provide that critical support, providing assistance with developing strategies and interventions to hopefully finally push this needle forward. This slide, I'm just going to kind of talk through for just a few minutes because it was kind of our 5-year anniversary slide. It's hard to keep this one current. It's already out of date and we just updated it like last week. As of today, we have 526 counties across 43 states that have passed resolutions to participate in the Stepping Up initiative. And we consider that as covering about 48% of the national population. Approximately 2 million times each year, people who have serious mental illnesses are booked into jails. We now, as of today, have 5 states who have launched statewide Stepping Up initiatives. So your colleagues are Pennsylvania, California, Alabama, and Ohio. So welcome, welcome. We're going to be enjoying working with you and bring that experience that we have already started with in those other states to Kansas. And then as of, I think, yesterday, we have 28 innovator counties. These are counties across the country that are being recognized for kind of blazing the Stepping Up trail, if you will. And they have demonstrated that they are able to establish baselines and get to their data and track progress. Next slide. So how does Stepping Up work? And it certainly will be different for Kansas having this TA center, but for the broad, population across the country who are doing Stepping Up are receiving it through this broad-based TA approach, where they are listening in on the webinars we provide. They're going to our website where it's loaded with all kinds of guidance, briefs, documents, and then as occasionally able to provide those peer-to-peer connections in working through email connections and so forth on providing some assistance. That next level that is described there, the intensive county level TA, is when the Justice Center actually goes on site into a county. We generally spend like a year and a half. We go in with the county, work to pull their data, analyze their data, and work with them on identifying the recommended next steps. A project that is of this nature was just completed in November of 2019 in Douglas County. And then we have this state level approach that is going to be rolled out here in Johnson County. I keep saying that, you guys, I can't help it, in Kansas. So I just want to also say that it's important to, again, understand that many counties will find that they've already been at this. They feel like they're doing work that is, what we're describing here. So, you might be saying, why do I join this Stepping Up initiative? But we really feel that there's a lot of different reasons to do this work. First of all, it will help you potentially further motivate or re-engage if some of that engagement and energy has been lost, to bring new people, new stakeholders to the table, to have access to, the different forms of assistance, to the different connections that can be made both at many levels, be it across, with different research strategies, with other sites across not only Kansas, but across the country, in helping you make decisions and guide your work. Next slide. Thank you. So this slide is, many of you maybe have already downloaded or have had a chance to look over this fundamental document of the Stepping Up initiative, reducing the number of people with mental illnesses in jail. 6 questions county leaders should ask. And so I'm going to go through these 6 questions because they really are the foundation of the work of Stepping Up. And the first is asking, is our leadership committed? And this is leadership at your highest levels in your county. So from your county commissioners to your sheriff, your DA, your judges, your behavioral health leaders. Your sheriff is certainly integral to this work. Trying to get, as Andrea said, you might not have all of these stakeholders totally committed, but as much of a broad-based level of support for this work that you can bring together is really crucial to the project. From there, the next question is, do we conduct timely screening and assessment? This is one of the very first steps that you'll be working on implementing in your jail. If you've not already implemented a validated screening tool, this is the way that you establish that baseline. You determine how many people, what is that prevalence rate of those with serious mental illness in your jails, and giving you that beginning marker. So that leads to the next question as far as, do we have baseline data? Being able to establish not only that marker around what is your prevalence rate, but other data points that are important to track that I'll be going over. Then, have we conducted a comprehensive process analysis and inventory of services? Many of you have already maybe done this work. Many places have done sequential intercept mapping, where you would look at each of the points across the justice system and basically do an analysis, a gaps analysis of what you have, what you don't have, looking at if those programs that you do have are meeting your needs and have capacity to serve your population. It's also important to look at your process, to be looking at all those decision points and determining, are you doing it efficiently? Are there better ways? And those kinds of problem solving conversations will then ensue from that. And then the next step, which I always say is the fun part, is prioritizing those next steps, not only looking at what projects and programs might be best to be implemented, but also, strategizing around funding and how to sustain this work. And then finally tracking your progress. Next slide. And these are the Stepping Up 4 key measures. I always say when I start with this slide that I wish somebody told me way back that I only needed to track 4 things. Data can be very overwhelming, and we know that. And to say, well, it's just these 4 measures is really not, being fair and accurate, but these are these 4 key metrics that's important to really keep your eyes on as you're implementing your stepping up policies and practices. The first is that you're tracking that you're reducing the number of people with mental illnesses being booked in your jail. So once you establish that baseline number, you're going to be using that as your guiding light in terms of where you want to improve from. The second one is that you're tracking that you're shortening that average length of stay for the individuals with serious mental illnesses in your jail. And you may say, well, why are we doing that? It's because as we have spent time in sites all across the country and looking at this data, we generally see that an individual with serious mental illness will stay in jail many times twice as long, if not longer, than that of the general population. So it's really important that you track this metric and look to achieve that you're reducing those length of stay. The third measure is that you're increasing connections to care, treatment, all those supports and supervision that will be needed in order to hopefully, set the individual up for success upon discharge from the jail. And then the fourth, reduce recidivism rates for people who have mental illness. So for the purpose of stepping up, we define recidivism as that rebooking into jail and tracking that for those individuals and looking to see if we're reducing that level. We recognize that progress in these areas in terms of achieving meaningful reductions is slow and difficult. So we will also be working with you to track other markers in terms of your progress. So these things could be such things as bringing on key stakeholders, growing services, engaging and hiring new staff, those kinds of other implementations along the way that are important to not only achieve, but to celebrate, because those are the steps that need to be taken to achieve these larger level goals in terms of reducing your overall prevalence rates. And I also want to say that while so much of what we're talking about today and so much around stepping up seems to feel focused on the jail, it's really important to understand that most of the strategies and solutions to reduce your prevalence rates actually occur outside of the jail. So all those other opportunities, be it that first, that crisis call, that point of law enforcement contact, all the way through coming into the jail, going through court, released on supervision, other points in the system where we can make improvements to better serve this population in order to make them be able to access services and be more successful are the kinds of strategies that tend to therefore circle back and impact those other measures. Next slide. Stepping Up Snapshot, just, everybody kind of likes to know where they stand, right? As of today, nationally, 526 counties have passed a resolution to participate in Stepping Up. In Kansas, we have 8, and just quickly, it's Reno, Johnson, Douglas, Barton, Lyon, Pottawatomie, Pawnee, and Riley counties. So thank you. We have folks listening in from those counties today. And we certainly hope that we will have many more counties joining this work. And then that other number in terms of those counties being recognized as innovator counties nationally, that grew to 28 this week. And we have 3 in Kansas, Reno, Johnson, and Douglas. So congratulations to them. I will say, Kansas has been tied until this week with Pennsylvania and California, but Pennsylvania went ahead. So we're going to be challenging Kansas to grow that number of innovators as a part of the Stepping Up work. All right, I am going to now turn it over to Mike Brouwer from Douglas County. Douglas County is actually a county that's been at this Stepping Up work now since the inception in 2015. And Mike's going to share some of the work that they've done in Douglas County and how it has helped them push their work forward. So turn it over to you, Mike.
Hey, Mike, you're on mute. Yeah.
Somebody has to be the one. Hey, thank you, Risa. And I want to thank the Justice Center and for KDADS, not only for the opportunity to speak today, but also for the opportunity to just express how grateful I am that we have this Technical Assistance Center launching in Kansas. This has been work that many of us on the state level for a lot of years have been very passionate about. And we didn't know about Stepping Up Technical Assistance Center when we started dreaming of these kind of ideas. But as all of you listed your names in the chat today, and I recognize so many of you, and so many of you deserve a big thank you for the work that you've done for well over a decade in Kansas for us to get to this point. So Mark, if you want to advance the next slide. I was asked if I would just share a little bit about Douglas County and how we got to be an innovator county and engage in stepping up. And one thing that former Sheriff McGovern always wanted me to point out was we didn't just start a couple of years ago on this, that this work is something that really has been now 20 years in development. The work that we're doing with reducing people number with mental illness in our criminal justice system. And, it started with just a part-time clinician from Burt Nash Mental Health Center working in the jail. And it was the idea of a professor from the University of Kansas who went to the sheriff and said, can we try this? And Sheriff McGovern jumped on board. And so that's where we started. It's hard to believe now the amount of work that our Burt Nash team does in our jail, that they started with one person just working about 27 hours a week. But that got us started. It didn't take long for the sheriff's office to see the value in having that collaboration. And so Sheriff McGovern became a giant cheerleader. I've seen that we have several people from the Sheriff's Association, several sheriffs on the call today. You all, I'm sure, are shaking your head that, you understood how passionate Sheriff McGovern was about this type of work. So that set the stage, and Burt Nash Community Mental Health Center really stepped up to the plate and became a partner. 20 years ago, there was a stigma around providing treatment to people with mental illness that were in the correctional system. The fear that they didn't want to stereotype the population with mental illness. And so a lot of mental health centers did not want to get involved in the criminal justice population. And Burt Nash said stepped forward quickly. And then, of course, University of Kansas has been a partner for the last 20 years of us and been a tremendous help. And we have several universities here in the state of Kansas that would like to partner with communities across the state. And so I'm hoping that's a network that we can create through the Stepping Up Technical Assistance Center. They told me I had to talk a little bit about grants. Those of you who know me, I hate those grants. They're a lot of work, all the data collection. But there is value in utilizing grants. You'll learn about grant opportunities through the Technical Assistance Center. But those grants improve your data collection, which is valuable, as Risa was talking about. And we were able to utilize the grants to add staff. I think the other day I counted in the last 10 years, we've added almost 8 or 9 staff positions to the reentry mental health and substance abuse treatment team at the jail. And all but one of those positions came from grants. So it's a great way to look to add staff, and collecting the data is going to make it easier for you to apply for those. So next slide, Mark. So we joined the Stepping Up Initiative in 2015, about 6 months after it launched. And it was actually Risa, being a Kansas girl, it was her urging, says, hey, why don't you join this initiative? And I think our response is, hey, we're doing the work, we might as well sign up. And so we did. And I want to point out is there's several counties here on this call today that are doing the work, and let's get you connected. But Stepping Up then provided a framework. Risa talked a little bit about that, about the 6 key questions. There is on the website, I'll go into further in depth on how you ask those questions in your community and who you ask them to. That was really helpful for us to share with some of our leadership and folks doing the work, the boots on the ground folks. Then the 4 key questions really provided us with some structure around our data. You know, when Stepping Up came out with the 4 key questions, like, well, we can do that. And yeah, I think we have that. And so we began to put our data together and to actually perform some analysis. You know, for those of you who do the work in your own communities, we spend a lot of our time focusing on helping people. And we may be collecting data, but we don't oftentimes take a deep breath and do some analysis and see where we're at. And Stepping Up was helpful to us. And I'll show a little bit of that in a second. Another big help that we did not anticipate with Stepping Up was this access to a national network of peers. We've developed some good friendships, but we've learned from other sites around the country. And it's like, hey, let's try that, or we can do that. And well, that makes little sense. Or we have this barrier. Does anybody have an idea? Those are the kind of conversations that happen with the peer network calls. And so that's another great asset. I also hope that we can develop a network here in Kansas so that we can formally provide that support to each other as well. Then I said we're talking about data, but putting together data and beginning to implement best practices has really been helpful for us to create targeted funding requests for implementing new programs, for adding new resources to the community. When we go to the county commission or the city commission and we say, we'd like to add this, we have the data to show why that can create an informed decision. And lastly, I don't know if we'll talk a lot about this today, but the new initiative with Stepping Up is the Set, Measure, Achieve. And they're encouraging all of us to set goals for those 4 key measures on how we can continue to move forward. So Mark, next slide, please. So this is some of the data that the Stepping Up and the Justice Center has helped us with in Douglas County. In 2014, we did a project that we were able to establish baseline data. 18% of our jail bookings were for people with serious mental illness. After a couple of years of working the Stepping Up initiative, we had been collecting this data, so we decided to pull it together. And you see there that we quickly were able to show reduction. So in 3 years, we went from 15% to 18% to 5%. And we've maintained that reduction, slight increase in 2019. That caused us to begin to ask questions with our Stepping Up work group. Why did we go from 6% to 9% from 18 to 19? What programs do we need to focus on? And we're able to utilize our data to begin asking ourselves those questions. Next slide, please, Mark. So this is just kind of my rah-rah cheer speech, I suppose, is that both Johnson and Douglas County, which are now innovator counties, we started small. It was just a few people who had a similar goal, who wanted to get together and solve some barriers and began to see opportunities in working together. In Douglas, we literally, our mental health team, were keeping the SMI data on a pad of paper with, and they wrote down every day who they saw and whether they had a serious mental illness or not. We didn't even start with a spreadsheet. That was step number 2. But now we've integrated that into our jail management system so we can track that electronically at the encouragement of the Stepping Up initiative. So as Risa said, first thing to do is join the Stepping Up initiative by passing a resolution. There's an example of that on the website, but also sign up for getting email blasts from the Kansas Technical Assistance Center and get email blasts from the Stepping Up initiative. Great information, great webinars. With webinars, I know we get a lot of requests to watch those. If you sign up for them and you can't make the webinar, you'll get an email later saying that it's been posted so you can go back and watch it when you have time. And then, of course, the network calls are super helpful. We've developed relationships all across the country utilizing those. So very excited about this today. Thank you to the KDADS and thank you to CSG for all your work. And we look forward to what's coming in the future. Thank you.
Thank you, Mike. I'm going to put Mike out there as well as our other Stepping Up counties for resources for you moving forward. I'm going to now turn it over to Katie Haber, and she's really going to get into more of the meat, if you will, about what the Kansas Stepping Up Technical Assistance Center is going to involve. So turn it over to Katie.
Great, thanks, Risa, and thank you, Mike. Really appreciate the overview of all the great work. Thanks to everyone for being here today. And of course, thank you very much to KDADS for really creating this center and bringing this to the state. Next slide, please. So I'm going to talk a little bit about, as Risa mentioned, the Technical Assistance Center and what it is and what we're hoping to bring to you all and to offer to you. The goal of the center is to really help position you all to really understand who's in the system based on good data, develop implementation plans based on each county's needs that really highlight strategies that work, that you are probably already doing, things to scale up, things to implement, and really set some reduction targets to track progress on what's happening after implementing some of those policies and practices. We really think that this will be accomplished through a few different avenues that have been covered a little bit so far: one-on-one assistance, group trainings, distance for now, but we're hoping in person whenever we can. Coaching from local and national experts, connections to resources, and of course, peer examples. And so we're hoping that this variety of methods in providing content will be helpful in sort of meeting everyone where they're at. We know that things vary county to county, and we really believe that Stepping Up provides this kind of flexible framework, again, to be able to meet you where you are at, and is really driven by your needs and where you are locally. Next slide, please. So we keep using this term Technical Assistance Center and want to provide a little bit more about what does that mean? What is it? So really what it is this remote resource center with staff support to help you achieve your goals around criminal justice and behavioral health. So what we plan to do is to get to know, for folks that are participating, we really hope that everyone here today joins on, is our goal is to really get to know you and your county and your team, and to be really able to offer that one-on-one support and provide resources, connecting you to other counties, etc. Doing research into what works for you, really considering the TA Center as essentially additional staff support for you to help you towards your goals. So we'll get to know what goals you have, what challenges you have, specific, of course, to each county, as well as what's really resonating with you across counties to help inform some of those group trainings. We will be consistently soliciting your feedback to ensure that what we're covering in terms of content and delivery mechanism aligns with your interests and needs. I think one of the great things about the TA Center and about Stepping Up is that with that flexibility, we're able to kind of revisit and pivot what's most important to you within the framework. So we're excited to get started and to hear about what your achievements are and what you want to build upon moving forward. Next slide, please. So really quickly, the objectives are, of course, to help you all establish and implement data-driven plans. We'd love to help identify additional best practice sites for connections, as Mike mentioned, really creating a network of support amongst the counties in Kansas, and to really trade information and best practices and what's worked and what hasn't worked. I think that sort of peer support network is often one of the most helpful aspects. We will be creating a central information bank for counties in terms of what resources are available. And as Andrea mentioned earlier, also thinking through and getting some feedback as we work with all of you. What are opportunities at the state level to help continue to support the work that you're doing and that success? So these are just some of the objectives that we're hoping to accomplish through the TA Center. Next slide, please. And so the benefits, of course, as we've mentioned, additional expert support, access to resources, really creating this network of supportive counties. As Risa mentioned earlier as well, success is going to look different in each county. So we're going to be continuously counting successes in a variety of ways, both in terms of real numbers as well as progress with some of those meaningful steps. And you know, again, that can be creating a collaborative team, which is really, really important first step, data collection and analysis, helping with screening and assessment, those sorts of things that really help position you to make these reductions moving forward. This whole center is really about meeting you where you're at. And as Mike had mentioned, making small changes to policy and practice that kind of add up over time, really according to your data and local circumstances. And another benefit that we are seeing is that this work can really help assist you in terms of positioning you to be able to prioritize some next steps and make some more targeted and compelling funding asks, whether that's from your local board or from state and federal government, and you know, philanthropic asks as well. So we're hoping that this process also helps with identifying where some of those needs might be, where funding might be most important, and help support your asks in those areas. Next slide, please. So in addition to what we mentioned before in terms of resources that we're going to be providing through the TA Center, additionally, we are going to be having a person join our CSG team who will work very much in partnership with KDADS, who will be based in Kansas and local to Kansas. Very important to us to have someone on the team that really is connected to Kansas and on the ground and be able to be a resource for everybody. Of course, the folks you see here today, as well as behind the scenes at the Justice Center, are available for consultation and one-on-one calls. We have a wide network, not only of counties that we work with across the nation, but also staff that are always willing to help and support these efforts. We'll be doing office hours and virtual site visits again for the time being, but hope to resume those in person as soon as we can. Next slide, please. So we will be working with you to provide resources that are most essential and targeted towards your needs. But I will go through some kind of key resources to get started as we're getting the TA Center started. One is what Risa had gone through. The 6 questions, 4 measures document is our shorthand for it. As you can see on the screen, it's reducing the number of people with mental illnesses in jails and 6 questions county leaders need to ask. This is really our foundational document that details the system change process of stepping up and provides that foundation on which we base the technical assistance moving forward. Another tool that we have is a self-assessment tool that's online that actually allows you to plug in your own county information, and then you receive information back about where you might want to focus moving forward. So it's a tool that sort of helps you think through where you're at currently and some different areas in which to focus on moving forward. We also have a project coordinator's handbook. It's really intended for the leader of the work in your county, the person responsible for bringing stakeholders together across systems and really working towards those common goals. This handbook is kind of a how-to guide on steps to take to guide those cross-systems planning efforts and setting and achieving those goals. And the last one I'll mention is our Stepping Up Strategy Lab, which is an ever-growing database of county examples strategies to tackle this work and various challenges within it. So these are just a few we wanted to mention in terms of getting started. We'll make sure that all of these resources are available to you, and this won't be the last time that you hear of these or have access to them or are connected to them. We have additional resources, of course, to connect you all with as well, but in terms of places to get started or things that you might want to look at first, these are some that we would suggest. And next slide, please. So in addition to some of those resources, which we will follow up, as we are posting the recording of this, we will make sure that we're pointing you in the right direction for those resources as well. There are some other items that you might want to be thinking about as well. And those are the questions on the screen that you can see mirror some of the beginning pieces of the initiative. Have you passed a resolution? Is there a planning team? Are you connecting dots between multiple initiatives, etc.? So these are some things some questions that you might want to consider as we're kind of gearing up to get started with the TA. There's also the resources that I mentioned before are also accessible on stepuptogether.org, which we will put in the chat as well as follow up the webinar with that as well. And next slide, please. So for next steps, we will be, of course, onboarding, as I mentioned, a Kansas-based person to really manage the TA center on the ground. And then that person will be beginning individual outreach to counties this month to really discuss your interests, your successes, what we can help you with, and really get to know where you're at and what you'd like some support with, and where we might be able to be helpful. We promise that by signing up, as you can see on the screen, what we'd really love to do is have you email kansassteppingup@csg.org to get on our mailing list for all of the TA opportunities and outreach. We promise to only send you opportunities you are excited about. We won't be taking advantage of your of this distribution list. And while we hope you choose to participate in everything the TA Center will offer, participation, of course, is voluntary. If you're emailing us that you're interested, it's really indicating that you want to hear about the various opportunities that the TA Center has moving forward. And we hope you all choose to participate and find it helpful in your efforts. I think the more participation, certainly the more that will come out of it. So again, we're really thankful to be here today and at this point, and thank you, KDADS, for establishing the TA Center. And we're really looking forward to working with all of you and getting to know you even better and building on the great work that you're already doing. And Risa, I'll go ahead and turn it over to you.
Thanks, Katie. Yeah, so I haven't seen any questions in the chat box, but Mark, maybe if you can put it to gallery, and we'll just feel free to either put a question in the chat box, or I don't know how Zoom proficient I am or everyone else, and I can't necessarily see everybody at once, but you can, use the under, under reactions at the bottom. It's a reactions. Isn't there a raise your hand? Just hit the thumbs up button if you have a question or something. We'll try to figure out how to call on individuals. If there's just, here's a Dave. Do you have a question? Dave Williams?
If somebody was looking to get involved with staffing, as far as trying to find a job with what you guys are doing, where would we have to go? I'm sure you're going to need some people to actually work, the website or whatever that you're doing to, allocate resources for people. So I work with interns in a consumer advocacy program, and we're trying to get them vocationally prepped for this kind of work. So I'm trying to get resources where I can get them hired on somewhere after this program.
Okay, well, Dave, maybe that's something we can circle back with you on in terms of, how to bring those resources to the project without, maybe going into a whole lot of detail today and learning a little bit more about what you have in mind. So thank you, though, for offering that.
I appreciate it.
Any other questions? Any hands up? Mark, if you see one, I don't, just call on it. not seeing any questions. I hope that means it was really comprehensive. Anyone, final question or comment before we sign off today? Feel free to unmute and go for it.
The website that you guys are letting these resources through that we would all link into, how can we be assured that that's HIPAA protected?
Well, the information that's on the website does not involve any, personal health information. So I can't think of a situation where, we've had to cover for that. Anything else? Everybody knows they're going to immediately email the website, the email line for us. And gosh, I guess we will say again, thank you to everybody that's participated today. Thank you again to KDADS for their support. And again, just to let you know how excited we are to kick off this work. Please, please, please get with us individually. We're more than happy to reach out, schedule a call, schedule, if you have a particular, group in your county, in your community that you think would benefit from a shorter presentation. We've been doing a few of those, so just let us know about that as well. And Commissioner Brown, anything at all you wish to say here at the end?
Yeah, I did want to just say that we also recognize that while we're standing this up at the TA Center and providing some free TA to counties, that there might also be a need for some local support of the counties financially to get some of this stuff going. So we will be looking at ways that we can provide that support going forward. We had a budget enhancement that didn't quite make it into the governor's budget this year, but we will continue to work on looking for ways we can help fund mental health in jails and also diversionary programs in counties. So as we're doing that, one way to make sure that you're staying in touch with us about those opportunities will be through maintaining contact with the TA Center. So I encourage you to, even if you don't necessarily know how you're going to do this now, go ahead and get involved so that when those funding opportunities come up, you're already familiar with the language that will be in the grant applications.
Thank you.
Sorry, Risa, I was just gonna follow up on Commissioner Brown there, that with this being a project that KDADS is invested in for the next 3 years, we certainly don't anticipate everyone being at a place where they're ready to stand up their own local initiative tomorrow. And that's why we really encourage you to visit the website and sign up for the email lists so that as you kind of move forward, maybe that's in 6 months or a year when your local community is kind of more wrapped around this idea that, we will be here then too, to help. So, but go ahead and sign up for the emails at least.
All right, Katie, anything you want to add?
Sorry, I could not take myself off of mute. No, just I appreciate everyone being here today and echo Andrea's comments that, this is really about us getting to know you and see how we can be most supportive and helpful of you all. So we're just really looking forward to being in touch.
All right, then I will just say again, thank you, everybody, and have a good rest of the day. Thank you.